All right, well, thank you very much. I'm Bob Shin. I'm from Washington, D.C. In the United States. I'm at Georgetown, so I direct the MS Center there. We follow about maybe 3,000 patients with MS. And so we already heard about the idea of maybe icobrain MS helping us in our assessments from a research standpoint. I'll say that we've had the opportunity to participate really clinically. So we're approached to say, well, here's a tool. Would you be interested in incorporating this? I don't know if you would know the geography. So Washington, D.C. is in the center of the East Coast. We're surrounded by Maryland to the north and Virginia to the south. So our patient population comes from these regions. We engage with a number of radiology centers in our area. So I sort of identified 6 centers sort of in a ring around D.C. that were interested in incorporating icobrain MS. Now again, we've heard that one possible use of a digital tool like this would be, for example, enhancing our assessment of the MRI to better identify lesions, perhaps help in diagnosis. Later, we're going to hear a little bit about maybe using a tool to help us follow patients, maybe monitor how they're doing on the different therapies. I just really wanted to highlight one point, which is that I feel this tool may be useful really in my initial assessment of our patients, because as we're in this meeting, we're hearing all about many different treatment options and kind of struggling to understand what treatments would be appropriate for which patients. Are there patients at higher risk for progression who might need higher efficacy therapy? So just want to highlight an example. This is just a patient of mine who had MS, and then maybe if we can just advance to another slide, and a different individual. And I chose individuals where, to my eye, looking at their MRIs, they seem fairly similar in terms of T2 lesion burden, in terms of ventricular size, for example. And that's what we do. I mean, you said we hate looking at MRIs. I like looking at MRIs. I think it's kind of fun. It's like the highlight of my day. I don't know talk about bladder symptoms and fatigue. It's like, look at your MRI. But if you could advance one more slide. Now, the difference is normally I just look, or even our radiologist. Oh, compared to the last MRI, T2 lesion, blah, blah, blah. Unchanged from previous, no enhancing. That's sort of where the report ends. Occasionally, there'll be a statement that there are signs of atrophy. Sometimes they'll notice if they're incredibly large, it doesn't turn this out. When I point out here, the first patient, and again, this sort of a typical patient, when we get our reports back from icobrain MS, I can see, I don't know if you can understand this, there's sort of an assessment of whole brain volume, as well as actually gray matter volume. And the MRI is plotted against age-matched controls. I mean, it drifts just because all of us, sadly, over time, begin to lose brain volume. So I don't know if you can tell, but for this individual with this MRI, I see that whole brain volume is at about the 50th percentile. Great. And gray matter volume, my kids are like that too. They think every screen is a touch screen. Gray matter also slightly greater than 50th percentile. Good to know. Nice. But the other patient, if we advance, where, to my eyes, very similar in terms of just like my eyeballing, I'm not sure about this, but I look, whole brain volume, more like at the 25th percentile of age. But gray matter volume, how can I calculate the cortical volume below the first percentile? 99% of people this patient's age have more gray matter volume than this individual. And when I start to see things like this, I was like, this tool may be helpful for me, even on initial assessment as I'm trying to make my treatment decision about who might benefit from higher efficacy therapies. So that's really the only point I want to make. I'm going to hand it over to my colleague now.